So today we will see about the third chapter of Unit 3, that is methods for assessment of nutritional status. Means here we will see the methods by which we can assess the nutritional status of individual. Okay. So, nutritional status of individual is influenced by the diet or food intake. Okay, means whatever food we are taking, by this we can say what is the nutritional status of that particular person. And the utilization of the nutrients, but also by some internal external environment factors also. Means not only just by food we will say about the status of nutrition, but also some internal and external factors are present to measure or to assess the nutritional status. By studying these factors we can determine the nutritional status. Certain methods are used to assess nutritional status. Means some methods are used to assess these things. We tend to classify them as direct methods and indirect methods. Means there are two methods. One is direct method, one is indirect method. So here we will only focus on the direct methods of nutritional assessment. Okay. So in this chapter we will see about only the direct methods. So direct methods used for assessment of nutritional status may be summarized as ABCD. That means A for anthropometric measurement, B for biochemical assessment, C for clinical methods, and D for dietary assessments. By these four methods we can assess the nutritional status of individual. In this chapter we will see the explanation of these four methods. Okay. So first is anthropometric measurement. So the term anthropometry literally means, anthro means man and pometry means measure. So how man will measure, that is known as anthropometry. So anthropometry is the measurement of human body at various ages and level of nutritional status. Means at various at various level of age, if any human will measure themselves, they will measure their body or the level of nutrition, that is known as anthropometry. The most commonly used measurements include measurement of body weight, measurement of standing height or crown heel length, measurement of body circumference and body fat. These things when we will measure, that is the anthropometric measurement. Okay. In children, the three most commonly used anthropometric indices to assess their growth status are weight for age, height or length for age, weight for height. Means in case of children, there are three most commonly used anthropometric indices, that are weight for age, means in this age what is their weight, in this age what is their height, according to the weight height is correct or not, or according to the height weight is suitable for him or her or not. That is the most important anthropometric measurement. Okay, let us briefly review each of these things. Nutritional status refers to the state of health of an individual as it is affected by the intake and utilization of nutrients, that is protein, carbohydrate, fat, vitamin and minerals. So nutritional status means the state of health of an individual which is affected by the intake and utilization of nutrients. Means whatever we are taking, whatever foods we are taking, whatever nutritions we are taking, that like protein, carbohydrate, fat, vitamin, minerals, that are going inside our body, that are healthy for us, our body is in nutritional condition or not, just we have to measure it. That is the nutritional status. So at first we will see that weight for age, means at this age, at 7 or 8, just like this weight is correct or not, like that. So body weight indicates body mass. Body weight means the body mass. It is the composite of all body constituents such as water, mineral, fat, protein and bone. Means human body is made up of these all things. So along with this, what is the body mass of the individual, that is known as the body weight. Repeated measurement of weight at regular period is a sensitive indicator of change of nutritional status. Means just in the time of birth we have done the weight for the child, but after 3 to 4 years gone, we have not done or we have not taken the weight for that child, it is not good. So repeated times we have to measure these type of things at a regular period of time, so that we can measure that this child is becoming healthy or not, nutritional status is in which condition. Okay, particularly children detected over a short period of time, which may be due to poor diet or short duration or illness or infection such as diarrhea etc., indicates potential malnutrition. Means small changes, if any small changes will be done in the body weight, so we have to justify that this is good for their health or not, this is this child is going to the malnutrition period or not, this child is healthy or not, we have to measure this. If there will be any problem, then we have to consult with the doctor. Weight is therefore indicative of short-term malnutrition. Means weight is one important factor for the malnutrition also. Along with weight, appropriate age assessment is also necessary for assessment of nutritional status. Why? So why this age is necessary along with the weight? Because we all know that body measures such as weight, height etc. increases with the age. Means when the age will be increased, this weight and height can be increased. So if the correct age is not known, it might not be possible to have an accurate assessment. Means if any child had came to take the measurement of their height or weight, but he or she don't know that what is their age, so we just can't say that this weight for this child is proper or not, they need more weight or they should gain weight or they should lose weight. We can't say if we will not know what is the age of that person or that child. That's why age is a vital factor. So weight for age is used as a measure of nutritional status. A low weight for age is referred to as underweight. Means according to the age, if the weight will be low, then it is known as low weight, okay, or underweight. So low weight for age is indicative of underweight and short term malnutrition. Means according to the age, if the weight is lower than the mean or than the average, then we can say that this child are going towards a malnutrition condition. Okay, various types of weighing instruments are available to measure weight. See here some pictures given to weight, like these things by this or by a weight machine. Means balance beam, spring scale or by electronic scale. This is looking so funny, yes. But for the small baby this can be done, okay. And usually we can see this method, electronic scale. Okay, next see the next question. Then you may ask is, how do we know that actual weight measurement obtained for an individual is normal or appropriate for his age or not? Means how can we say that for this age this weight is good or not? For this we need to compare the actual obtained weight. Means we have to know about the standard or the mean or the average, we have to know, so that we can compare. So with a set value, there are some set values that is called standards. We have to see these standards, we have to tally with these standards, so that we can say that the particular child or particular human beings is in good condition or not. Okay. So in India, for children, we use the WHO growth standard, for which was discovered in 2006 to compare the data. These standards are primarily average body measurement of well-nourished and healthy children who belonging to well-to-do society, who are medically and socially well protected, and these values are used for purpose of comparison. Means at the time of making this standard scale, they had taken a developed and proper nourished or and healthy children to make these standards, and after that, after making that standards, we all are comparing all the child with that standard version. Okay, so tables providing the WHO standard measurements are given. See here one table is given. Girl weight for child birth to 3 years. See here one scale is given, growth chart is given. Alternatively, weight obtained can be plotted against age on a graph or chart so that growth pattern can be followed graphically in comparison to reference standard. This process is known as growth monitoring. Means at first we should know the standard graph. After that, when we will measure for any child, then we have to tally that too with the standard, okay, so that we can identify that the boy or the girl is in the nutritional condition or not. Okay, so this process is known as growth monitoring. The chart used are called growth chart. Mean which chart is used, that is known as growth charts, and which are designed as a mean of monitoring. Means it is the average or it is the standard of the monitoring. If plotted weight for age of child falls on green band, then the child's growth is normal. See, these are the standard. If the baby's weight according to the age will come in this green band, then it is normal. Okay, if it falls on the yellow band, the child is moderately underweight. Means if it will come in this yellow band, then it is moderately underweight. And if plotted weight in the orange band, the child is severely underweight, means in the malnutrition condition. Means if they will come in this area, in orange area, then we can say that he or she is underweight. The growth curve should continue to go up every time the child is weighted. Means we should compare this growth chart whenever the child will come to the doctor and whenever they will do the weight according to their age. Straight or downward curve indicates poor growth. Means if, see, the curve is, wait, just I am rubbing these things. See, if the curve will go upwards, then the child is growing and becoming a healthy baby or healthy person. But if the curve will go downwards or it will go straight, then we can say that their age is growing but their weight is not growing. That's why they will become underweight. Okay, so this was about the weight according to the age. Next is length or height for the age. So length or height is a commonly used measure to access nutritional status. Length or height reflect the total increase in the size of the individual up to the moment it is determined. Means the length or height is a commonly measured things to access the nutritional growth or nutritional status. That means according to the age that child is growing in their heights or not, we can measure by this. Okay, in case of infants and children less than 2 years of age, length is measured known as crown heel length. You should read these short things very well. That in case of infants and children who is less than 2 years of age, it is measured, this age length is measured, that is known as crown heel length. The instrument which is used is called the Infantometer, as illustrated in 6c. This is the Infantometer. See, it is like an elastic band is there, and the baby will lie down and then he or she will be measured. Okay, in case of children who are more than 2 years of age, or in case of adults, standing height is measured. Means if the child is more than 2 years, or for the adult we are measuring, then they should stand and then we will measure it. A portable anthropometric rod or tape can be used for measuring height. Okay, this is anthropometric rod and this is infantometer. For infant we can measure like that. Okay, but unlike weight, height changes very slowly to be used by itself to detect changes in growth pattern within a short period of time. Means within a short period of time, like 6 months or 9 months or 1 year, the height changing will be a little bit, but weight can be increased or decreased rapidly. Okay, height is affected by long-term nutritional deprivation, that is a deficiency of one or more nutrient over a long period of time, resulting in stunting and low height for age. Means if anyone will not take the proper amount of nutrition for the long period of time, then they will not become longer, that means their height will be stunted. Stunting is consequence of chronic food deficiency, means it is only done by the food deficiency. So if you come across a child who has low height for his age, in all probability it reflects the cumulative effect of chronic food deficiency and infection over a long period since and even before birth. Means before birth, if mother will not take proper amount of nutrition, then that will be problem for that child. And also after birth, if the child will not take proper nutrition, then their height will not be increased. So low height for age is indicative of stunting and chronic malnutrition. Means if they are not increasing their height in their height, then we can say that this is one kind of malnutrition. They are going towards the malnutrition and their height is not growing properly. Okay, so this was about the height for age. Next we will see the weight for height, means according to the height or according to the age their weight is proper or not. Means just think that for a baby a height is 4 feet. So according to that 4 feet their weight is proper or not, just we have to see. By relating the weight of a child to its height or length, an objective measure of the child's degree of thinness can be obtained. Thinness indicates in most cases a recent and severe process of weight loss, which is often associated with the acute starvation or insufficient food intake and or severe infection or disease such as diarrhea, measles, etc. So when weight of the child is low for the height is called wasting. Means if we will wait, just I have given one example that if we will go for a child that his or her height is just 4 feet, for that child the weight is proper or not. If the weight will show than the low than the standard, then we can say that boy or girl are going towards the malnutrition factor. So that we can say their height according to their height the weight should be proper. So when weight of the child is low for the height, it is called wasting, means they are going to the malnutrition. Weight for height is a very good index for short duration malnutrition. Means if we will take the weight and height at the same time, then by these two factors we can tell to them shortly that they are in proper nutritional guide or not. Okay, low weight for height is indicative of wasting and of short duration malnutrition. So we have seen that weight, height and age together and weight and height independent of age are good indicators of child's nutritional status. So these three, means height, weight and age, these three are the good indicators nutritional status for the nutritional status. Recent evidence that National Family Health Survey suggests that 38.4% of Indian children under 5 years of age are stunted. 35 means short height. 35.7% are underweight and 21% wasted, means they are not proper according to their height, means the weight is not proper according to their height. So these are the survey for the National Family Health Survey. According to the National Family Health Survey, this survey was being done and they suggest that 38.4% of Indian children under 5 year age are stunted, means they are not in their proper height. 35.7% are underweight and 21% are wasted, means short height according to their age. According to their weight. With 7.5% severely wasted, means severely their height and weight not matching properly. Okay, here one graph is given that how much are stunted, how much are wasted, severely wasted and underweight, all are given for rural, urban and in total. Okay, so far we have looked at anthropometric measurement of infant and young children. Next, a review of indices for adult and adolescent are there. See, till now we have seen about the child and the infants. Now we will see about the adults. In case of adults, the body mass index, that is BMI, which is used to assess nutritional status. Means they are in proper nutritional status or not in case of adults. So these are measured by the body mass index. So BMI is a simple index of weight to height used to classify underweight, overweight, obesity in adults. So BMI gives a measure of the body fat based on weight in relation to the height and applies to most adult men and women aged 20 and over. So BMI is defined as the weight divided by the square of the height, means weight by height. So what we can write, BMI equal to weight by height meter square. Weight should be in kg and the height should be in meter square. Okay, for example, means see here there will be one line and height will come in this place. Okay, so for example, if an adult woman weighs 60 kg and her height is 155 centimeter, then BMI for the woman would be 60 by 1.55 whole square. That means their weight is 60 kg. As we have seen, BMI equal to weight by height meter square. So weight is 60 kg and after that 155 centimeter we have converted it into meter, and then 1.55 square means the height will be in square. So after that which value will come, that will be the BMI, means body mass index. The BMI can be interpreted as under, means if the BMI will be lower than 17.0, it will indicate moderate and severe thinness. Means if the BMI will be lower than 18.5, it indicates underweight, and the BMI from 18.5 to 24.9, it will indicate normal weight, and the BMI if it will be more than 25.0, that will indicate the overweight. Okay, so BMI greater than 30.0, that will indicate obesity. Means if this will be greater than the 30, then we can say this particular person is in obesity or overweight or underweight, whatever, by the BMI, means body mass index. Okay, recent data suggest that 22.9% adult Indian women and 20.2% adult men are underweight. On the other hand, 20.7% women and 18.9% men are overweight or obese. Evidences suggest that high BMI is associated with diabetes and high risk of cardiovascular morbidity and mortality. Means if the people who are the overweight, there are high risk of cardiovascular arrest. That means the heart attack or the diabetes can come to that body. Okay. Next, see nutritional indices, means nutritional factors for older children and adolescents. For children and adolescents 5 to 19 years of age, BMI is used to assess the nutritional status, and that is calculated the same way as for adults. Means BMI is also calculated or assessed for the nutritional status and for the adults also. But here BMI is compared with typical values for other children same age and sex. Means BMI is compared against the percentile of children of the same age and sex. Means same age and sex, for same age and sex, BMI is compared, and BMI for age percentile is used to classify children and adolescents up to different grades. See here one chart is given. BMI for age percentile less than 5 percentile is underweight. Means according to the current survey, means in the current years, like within the 10 years of last survey, less than 5 percentile is underweight, 5 percentile to less than 85th percentile, that is healthy weight, 85th percentile to less than 95th percentile, that is risk of overweight, and 95th percentile or greater than it is overweight. Okay, So BMI for age standard are given, which are included in assessments. This table is given. Information regarding other anthropometric measures such as body circumference measurement and body fat measurement is provided in the box 1 under other anthropometric measurement heading. See, here we will see one measurement type. See, the mid upper arm circumference MUAC measurement means not only the height and weight. According with that, some body parts will be measured also, so that we can say that nutritional status is in good condition or not. So mid upper arm circumference means, just see the picture, we have to take the measurement of the mid upper arm, which is commonly measured to assess nutritional status of infant and children. Arm circumference basically includes the bone, fat and muscle, means their bones are in good condition, the fat are in proper amount or not, muscles are strong or not. By this method we can measure. Okay, so arm circumference increases with age, but between 1 to 5 years it does not change much and remains fairly constant. So measuring the MUAC means mid upper arm circumference is useful in identifying malnutrition in children. So and how it measured? So fat and muscle, you might be aware, are the body's energy and protein reserve. Means if we can see that the fat is there inside the body, then energy is stored here. Then reserves are reduced the body when there is not enough food. If that person is not taking food for 2 to 3 days, then this energy which is stored inside the fat, that will be engaged. So in children suffering from protein energy malnutrition in early childhood, the arm circumference can be measured using flexible fiber glass tape and can be interpreted as under. Means this method is being done by a fiber glass plate or glass tape or any measurement tape. So if MUAC mid upper arm circumference that will be less than 110 mm or 11.0 centimeter, it indicates the severe acute malnutrition, means they are in acute malnutritional condition. The child should be immediately referred for treatment. Means if the child will be the child's mid upper arm will be less than 11.0 centimeter, then they should take the treatment. MUAC between 110 mm or 11.0 centimeter to 12.5 centimeter, that indicates the moderate acute malnutrition. The child should be immediately referred for supplementation. MUAC of between 125 mm 12.5 centimeter and 135 mm 13.5 centimeter, that indicates that they are in good condition. They are in good condition. Okay, next is, here we have seen only the mid upper arm. Here we will see the waist and hip circumference measurement, means the waist and hip are in proper measurement or not. By seeing this, we can also say that this child is in proper weight or not. So waist circumference WC is a tool which is used to assess abdominal fat and health status primarily in adults. WC predict risk over and above that of BMI, regarding which we learned earlier. Waist is measured around the navel in a standing position, means the child should be in standing position. See, by this is waist and this is hip. So the child have to be standing, and then we will measure the waist and their hip. Okay, so high risk. See, in the high risk, if men will be greater than 102 centimeter, they are in risk. If the woman greater than 88 centimeter, then we can say they are in high risk. Okay, so see, the navel position, the standing position using a flexible non-stretchable tape, means we should use a non-stretchable tape. We have to take one measurement tape, and that should not be stretchable. Waist circumference at which there is a high risk of ill health, there follows. The high waist circumference indicates a high risk of obesity, means if we will see that the waist measurement or hip measurement is greater than the normal, then we can say that there is a high risk of obesity which is linked with the disease like diabetes, hypertension, coronary heart disease. Measuring hip circumference along with waist circumference and calculating the waist hip ratio is a good indicator of abdominal obesity. Means if the ratio between waist and hip that will be greater than standard, then then we can say that that person have the abdominal obesity, means in the abdominal area some fats are present. According to WHO, a healthy WHR, that means waist hip ratio, is 0.9 or less in men and 0.85 or less in women. So a WHR of greater than 1.0 for men and less than 1.0 for men and less than 0.85 for women is an indicator of abdominal obesity. Means if these measurement come, then we can say that this is one indicator of abdominal obesity. Means these are the standards. Fat fold thickness assessment of body, means skin fold thickness measurements have been commonly used to determine percentage of body fat. Means if the skin will be folded and that will be thickened, then we can say that body fats have been stored in that position. We have learned earlier that BMI provides a simple and useful population level measurement of body fat for all the ages of adults. However, it can only be considered as a rough guide. Means this is the rough guide, not this is proper things or proper factor for the measurement for BMI, or they are in good condition or in malnutrition or not. For only by measuring only the fat we cannot say properly. Okay, so BMI does not measure fat directly, but really is or relies only on body weight, height, and does not take into account overall body composition. Means by BMI just they only not measure the fat, they will rely on the body weight, height also. So alternatively, when there is excessive intake over a long period of time, there can be accumulation of fat under the skin. Means if anyone will take so much amount of nutrition, then the fat will be accumulated under the skin also. So skin fold measurement therefore is a simple means of measuring subcutaneous fat, means the fat which is present under the skin. It is also known as skin fold thickness and is an indicative of fat or fat reserves in the body. Okay, biceps, subscapular or supralic region, means the fat are present under the skin or not, just to measure these types of things, that weight, waist, hip measurement, this type of measurement is being done. Okay, so these all the things whatever we have seen, these are for the that is wait, just wait. These all things we have seen in the anthropometric measurement. Next we will see the next we will see the clinical assessment. Okay, so clinical examination is one of the simplest and most practical method used to assess nutritional deprivation. Nutritional deprivation here refers to deficiency of vitamin, minerals, proteins, energy and other nutrients. Means if there is any deficiency of vitamin, minerals, proteins, energy and other things, then we can say that nutritional deprivation is there. When there is nutritional deficiency, it is associated with physical signs. Means if nutrition will not be present properly inside the body, then we can see some symptoms or sign from outside of the body. Clinical signs are changes in the body which are indicative of nutritional deficiency or excess. General clinical examination with special attention to organs like mouth, eyes, skin, nails, tongue and muscle, bone, etc. It is useful. Therefore, knowledge of relevant signs, means we should know about the signs which is measured clinically, so that we can detect the problem and we can go for the curement of that. Okay, next here is one table which shows the physical sign indicative or suggestive of malnutrition. Means general normal appearance, if it will be healthy or alert, then the signs associated decreased activity level, means activity level they will be decreased. Body area hair, means if hair will be shiny or firm, not easily plucked, then lack of natural sign or hair dull and dry, thin and spots, means the signs which is in malnutrition. Means if they will be normal, the child will be in normal condition, then the hair will be shiny and it cannot be plucked easily. But in case of malnutrition, the lack of natural sign will be there, hair will be dull and dry, it will be plucked easily. Face, the skin color of the face in the normal condition it will be smooth, pink and healthy. In case of malnutrition condition, the skin color will be lost. Like this, all the things are given in this chart. Okay, eyes, bright eyes or shiny eyes will be there in normal condition, but in case of malnutrition, the eye membranes will be pale and redness will come. For the lips, in the normal condition lips will be smooth, but in malnutrition condition redness or swelling can become. Tongue, in the normal condition the tongue will be deep red in appearance and not swollen, but in case of malnutrition swelling will come. For the teeth, for the normal people no cavities or pain will be there, but in case of malnutrition gray or black spots can come on the teeth. For the normal gum it will be healthy, but in case of malnutrition spongy or bleeding will come. Glands, face not swollen, means face will not be swollen in case of normal people, but in case of malnutrition people thyroid glands can be enlarged, parotid gland will be enlarged. In case of skin, though no such rashes or swelling will be there in the normal people, but the skin will be dried and some it will peel for the malnutrition condition. And nails, in case of normal condition it will be firm pink and muscular level will be good and good muscles will be there. In case of malnutrition people, nails are spoon shaped and the muscles will be wasted, and muscles, baby skull bones are thin and soft, round swelling, bones will not be so good. So these are the clinical assessment which is fast and easy to perform, but the limitation is that they do not help in detecting early cases. Means in the early period we cannot detect any problem by this. Okay, so this is the prolonged period things. So after this we will
Next is biochemical assessment. Biochemical assessment, that is the laboratory test which is based on blood and urine, can be important indicators of nutritional status. Means their blood number of blood components are proper or not, urine is coming proper or not. That is the biochemical assessment, the laboratory test. By the laboratory test we can solve it. Biochemical assessment deals with measuring the levels of essential dietary constituents, that is nutrient concentration, metabolites, the body fluids, normally blood or urine, which is helpful in evaluating the possibility of malnutrition. For example, anemia is the most widespread of all the nutritional deficiency found among individuals in our country. Means number of red blood corpuscles is lower than the normal. So it is largely due to iron deficiency. So the measure of the hemoglobin in the blood is helpful in evaluating the possibility of iron deficiency. Similarly, a measure of the level of iodine in the urine reflects the iodine status in the community. Means by measuring the after the biochemical test of urine, we can say that now iodine is properly present or not. Okay, the advantages of using biochemical assessment are that it is useful in detecting early changes in body metabolism or nutritional status much before the appearance of overt clinical sign and symptoms. It is precise and accurate, but it can be time consuming and expensive. It requires trained professional and facilities should be present there. Okay, so these are the biochemical assessment. The last one, that is dietary assessment for the nutritional status. So from our study so far, it must be clear that diet or food intake is a major lifestyle factor which influence our nutritional status. Dietary assessment therefore involves reviewing the intake of food and the nutrients and comparing the amount consumed with reference value to see whether deficiency or excess is likely. So when a systematic inquiry into the food supplies and food consumption of individuals and population groups is made, we call it as a diet survey. Means we can do a survey on the diet, so that we can say that this community or this population is in proper diet or not. That is the dietary assessment. So diet survey can be undertaken at an individual and or family or household level. And here is one methods of diet survey, that is national level. This food balance sheet, institutional level for hotel, hostel, hospital, canteen, jail or etc. Inventory method, weighment method. In household level, this inventory method and weighment method. Consumption of expenditure survey. Individual level, that means food record or diary or diet history, 24 hours dietary record. By these methods the survey can be done. The 24-hour recall method is probably the most widely used methods of dietary assessment. Based on a structured interview, the person recall food and beverage intake during the previous 24 hours. Method means if there will be any infection or whatever by the food, then now we can do the survey 24 hours recall method, so that we can understand whatever that patient had taken before being ill. So individual recalls and what was eaten, how much eaten, how was the food prepared. So all these things will come after that survey. So a schedule of 24-hour recall method of diet using this schedule. Yes, while using this method, you may have noticed that it is quick and easy, and it will depend on short-term memory, but recording one-day dietary intake only may not be truly representative of our usual or habitual intake. Okay, so that this all are the methods for the nutritional status. Okay.